Hi, I'm Mike Miliard from Healthcare IT News. I just had a really interesting conversation with Karl Rove. Let's take a listen. Why is healthcare such a divisive political issue in this country?
Well, first of all, it consumes a lot of our economy, about 17, just over 17% and growing, and there are deeply divergent views of how to run healthcare. One model in the Affordable Care Act is top-down. We're going to have an independent payment advisory board in Washington, D.C. of 15 bureaucrats that are going to set the price for every procedure in every part of the country, and make big decisions about the nature of healthcare. And we're going to put everybody in a system that sort of looks alike and have it managed by the Department of Health and Human Services. And another view is we need to empower the consumers. This is a system that is best left to markets, competition, and consumer power, and flexibility and innovation will thereby result more often.
With Obamacare, having survived the Supreme Court and seemingly a settled issue, do you think it will continue to be a political fodder?
Yeah, I don't think it's a settled issue by any means. Remember, this was simply settled the issue of whether or not the federal government could require everybody to pay a tax if they don't have insurance. But the big questions are going to be whether this is a sustainable model. We have roughly 10 years of Medicare cuts, roughly 8 years of tax increases, in order to fund a program that is ramped up for 2 years and is in full operation for only 4 out of the first 10 years. We spent over 85% of the money on the Affordable Care Act in the last 4 years of the first decade it's on the budget. And if you begin to look at the out years, as we now have to in a budget perspective, it is unsustainable. And the assumptions on which it was based are turning out all not to be true. If you like what you got, you can keep it. We now know tens of millions of Americans are going to lose their employer-provided coverage. At the passage of the bill, the CBO forecasts 3 million people would lose their coverage. They're now up to 8, and they're on the low end of the scale. Even the actuaries of Medicare themselves say 13 million will lose their coverage. So we are likely to see a very divisive debate about whether or not this model is sustainable for the long haul.
Well, if health policy is a controversial issue, health information technology, which is why we're all here, seems to be pretty bipartisan. Newt Gingrich has written books about it, and President Bush talked about it in his State of the Union addresses. Why did President Bush think it was such an important issue to talk about?
Well, because look, technology, we do know this. When you have a sector of the economy that begins to adopt technology, it's hard to quantify the savings, but we do know that these industries become more productive. And the idea that cumbersome records, that big file folder in some doctor's office, and that if you go to another doctor, you got to recreate it. This kind of thing, it just looks inefficient. And we do know from the Veterans Administration, which was one of the early adapters of technology, that there were enormous efficiencies that readily became available. We're sitting here in New Orleans. We medevaced in the aftermath of Katrina patients from the VA hospital out of Katrina, and by the time they landed at Andrews Air Force Base in Washington, their individualized insulin prescriptions were able to be immediately fulfilled without any human interaction at facilities in Washington, D.C., because their records were all, were all electronic. And as a result, we knew exactly there's no questioning, no having to dig out a doctor, no mistakes. It was seamless, and that's an indication of what this can do. I personally had an early experience with health information technology that caused me, I had a sinus surgery, and the particular facility I had it done at was completely an early adapter in health technology. In fact, they designed their own software, and they were the best ear, nose, and throat facility in Washington. And I happened to have lunch with my doctor. He's got one of the best names in the world, Dr. Picken, an ear, nose, and throat doctor. And her husband, who was her then husband, who was a retired Navy officer who had overseen the transformation. And it was amazing they literally were able to quantify it. They said, we're spending 25% less on rent, because we don't need a big back room. We rent space on a server in Northern Virginia and one elsewhere, and this is an enormous savings to us. We're able to process patients. We're able to retain our staff longer. We're able to make better diagnoses quicker, and all of our physicians love it. The younger ones were quicker to adapt it than the older physicians, which you'd expect, but they were enormously pleased, and were able to quantify the savings for their practice.
Now, President Bush might have mentioned it during the State of the Union address, but it's arguable that a big reason a lot of us are here is because of $27 billion that was dispersed by the government to help build this industry. Would President Bush have ever considered putting out that sort of money to fund this industry, or would he have taken a different approach?
Well, first of all, the reason you were able to spend that $27 billion is because the groundwork was laid under the Bush years in putting in place the standards, architectures, and language. I mean, one of the biggest issues was, what terms do you use? And so this was a very tough task undertaken at the Department of Health and Human Services under 2 cabinet secretaries, funded by the federal government in the Bush years, and we began to make investments in health IT. Now, whether we would have done exactly what was done under the stimulus bill or not is, we don't know, but we very strongly believed in the transformational power of technology in the health arena and put in place the architecture, if you will, the foundation without which this progress would not be possible. I was amazed how difficult it was, even with all of the stakeholders involved, to arrive at an agreement on language standards, definitions, and so forth.
What role do you believe the government has in fostering innovation? Completely hands-off, or do you think that they should help foment the marketplace?
I think they ought to do basic research, and where necessary, as in the case of health IT, be the entity that helps bring everybody together to agree on standards. But we cannot be in a place where we rely upon the government for innovation. Look, our great drug companies, are enormous sources of innovation because they see a profit motive in it, so they take the investment and put it in there. Now, that's not to say in the health world that the government is unimportant. The National Institutes of Health plays a fundamental role in providing the basic science on which every health institution can draw. But at the end of the day, we are better off where we have markets, competition, choice, innovation, and a decentralized decision-making system rather than centralizing it all in the hands of government and waiting for them to take the lead.
And what role does government have in ensuring that all of its citizens get the care that they need?
Well, again, this gets back to the divide. There are 2 models of doing this. One is that you say the government's in charge, sets the prices, decides how much you get, collects money from people and pays for it. There's nothing so expensive as something that's free, and we're finding that out. The other model is put people in charge and let them make the decisions and tailor a system, which we can easily do through our tax code, to help those people who are at the bottom of the scale and can't afford coverage to get coverage. And this was the proposal that we pushed and didn't pass, but it would have been a different model. And the success of that model can be seen in Medicare Prescription Part D, which is Medicare's vision of this, which is we'll give every senior a certain amount of money. We couldn't get all of the means testing we wanted in it, so we give a little bit less to Warren Buffett and a little bit more to the working man or working woman who waited tables or wielded a shovel. But you're in charge. You get to take this money and pick an insurance policy to provide prescription drugs that meet your needs. So if you are at risk for diabetes, then so forth. If you got a history of heart disease, then there might be another plan that's better. This was passed in 2003. The CBO forecast it would cost $450 billion. This is the 10th anniversary of the program, and it's not going to cost $450 billion. More people used it than were anticipated. They signed up quicker, and they're using it more, and it will come in 40% under budget. It's the only government-provided health benefit. TRICARE, Indian Healthcare, Champus, Medicare, Medicaid, Children's Health Insurance, you name it. This is the only government-provided health program that's come in under its cost estimate. And again, it's because the model is put the consumer in charge and have competition and innovation and choice. And there are amazing things that happen when people start saying, you know what, it's my money. They start asking, I was talking this morning to 2 people in the healthcare industry who have given health savings accounts to their employees, which is the purest form of this competition choice model. And now suddenly people are saying, well, how much is that test going to cost? And why are you charging me more than he is? And are your informations in an electronic form so that my primary care physician can get them and hold them? And all of these kind of things are important to bringing about reform in healthcare.
It's no question that some people are being left behind. We saw President Clinton here yesterday, and he noted that life expectancy is on the rise, but not for everyone. And in the richest and most powerful country in the world, what can we do to make sure that everyone gets their fair share of all this innovation in healthcare and technology that's going on?
Change the delivery model. Remember, the most vulnerable in our society are served by 2 programs that are a government top-down program, Medicaid and Medicare. Medicaid for those who don't make enough to to get it from their employer, and or don't get enough to pay for it themselves and don't get it from their employer, and Medicare, which is for all seniors. And particularly our Medicaid population is at risk because this is a fundamentally flawed model that's unsustainable. There's an interesting study done by the pediatric care hospitals of Medicaid births, and they get paid 30% of their cost in a Medicaid birth. And look, that means the rest of us are picking up that tab, and it's an inefficient way to pay the cost, and it also is discouraging of quality service. Why does that person, that Medicaid mom, that single mom about ready to give birth to a child, less worthy of our support, why shouldn't she get the same access to care that she could have if she had an insurance policy that was subsidized through the tax system that allowed her to be in charge and choose? And instead, we put them through this terribly complicated, dreadful program that delivers, let's be honest, second-class care. And we're treating too many Americans as second-class citizens when we have the possibility of designing a system that will better serve their needs.